Exam study review for exam two. Exam two review. Ensure that you have your two devices. Make sure you have your chargers. Ensure that your devices are charged up. Ensure that you download the exam prior to the start of the exam. Remember, the exams are usually available an hour prior to start time. In addition, if you have accommodations, make sure that you provide that information to the professors. In the event that you think you might need the exam to be proctored on campus, send an email to your campus dean. Please include Dean Brown, Darlene Brown, and also the professor's name in that email requesting that exam to be proctored. Now, there's at least a 72-hour prior notice, and that's to ensure that a person is available and a space is available for you to take that exam. Ensure that you have a dry erase board, or you can use that sheet, that clear sheet protector, if you need those things to jot down or write down information. No paper is allowed during the exam. Be sure to go back and review your required readings. Make sure that you go back and review the previous classroom recordings. Okay, I'm trying to share my screen here. Okay, active listening. Remember, when we are communicating, there is a sender and a receiver. We want to think about verbal communication as well as nonverbal communication. Active listening is the most important part of communication, particularly, especially when we're taking care of our patients. So we do want to establish those therapeutic relationships early on. We want to ensure that we find out as much as we can about our patients because we do want to deliver that culturally competent care. So we want to find out what things do they know, what understanding do they have about the disease process and how to manage it. And then we want to address the whole person, we want to consider their physical and their emotional needs as well. These interactions require the use of effective communication strategies in order to provide support to the client. So we want to be active listeners. We want to let the patients finish what they're saying, allow them to ask questions if they do have questions, and just to ensure that they have really understood the information that we have conveyed to them. So we have key factors in active listening. The purpose, health-related reason for gathering data or giving information. So what is the purpose of this communication that we are having with our client or our patient? Discipline attention. Do not assume accuracy of information without checking it out first. We go in and we ask our clients, like we gather information with the health history, but we also need to verify that information because if they're disoriented or not oriented, then some of the information that they're actually giving us may not be correct. We want to clarify what we think we understood the client is actually saying to us. What if just to be sure that the information that was sent, that ensure that we receive the correct information, and then ask further questions if needed. We want to focus using all of our senses. What are we seeing? What are we hearing the patient actually say? Are we looking for those facial grimaces? Are we looking for that guarding? We want to look at those nonverbal and also those verbal cues. A common mistake in listening is to listen to words, but not really hear the words. So are we understanding or really comprehending the meaning of what the person is actually saying? Okay, let's look at some active listening techniques. I am listening to you. Restating, that is repeating what the patient said in a slightly different way. But paraphrasing, we are expressing in our own words what we think the patient has said. Restating, we're repeating what they said. And then paraphrasing is when we're changing it up, we're expressing what we think the person said, but we're using our own terms and words. So clarifying, we're asking questions in response to a patient's statement to be sure that we understand. We ask those questions. Those could be a more focused question. Like if the patient stated something and we want to ensure of really what they're talking about, we can go back and ask that question in a different way, but don't change the question because then you more than likely get a different answer. But go back and clarify, ask a question just to ensure that we understood what was being said. Okay. And remaining silent, that is therapeutic. That is considered as active listening. Just being present. It is okay to be silent. Summarizing, you are giving those main points of the information that you have gathered. You know, the patient has you and the patient have had a dialogue or conversation. And from that conversation, you list 3 things or 4 things that you pulled or identified that the client or the patient was really talking to you about, so that we give those main points from that. Minimum encouraging is when we use sounds or words to encourage the patient to continue with the information, to continue to speak to us about the information that they're giving us. That would be words like mm-hmm, go on, yes. And sometimes we kind of do like the hand motions as well, and that indicates we're asking the person to continue to talk. Reflecting, putting into words the information you receive from the patient at an effective communication level. So we want to put it in words that people understand. Remember, we're healthcare providers, so we're learning this terminology, but the information, the words that we use, a layperson, unless they're going to school or they're a healthcare professional, they're not going to understand those. More than likely, they will not understand the terms that you're using. So we want to always communicate on a level so that people can understand what we're saying. Validating allows the patient to correct information when summarized. So we go back and give those main points. And then we ask the client, hey, you know, is what I'm stating, the information that I'm stating here, these main points, is this correct? And allow the patient to say yes or no. And then we gain more understanding. Positive communication techniques. Using I messages, that is positive because putting that you're putting that back on you. That's positive. Just gonna pause for 1 minute. So, positive communication, when we use I messages, that is considered positive because that allows the patient to, not feel, what's the word, that we're speaking in an aggressive tone. It will not, it will promote communication if we use I messages when we are talking to our patients. Establishing eye contact. Now, we're not talking about with glaring eyes or leaning in, squinting our eyes, just establishing that eye contact. Look away, we look toward the patient. That's the eye contact. And of course, we want to keep promises. If we're telling the patient, hey, I will be back with your water pitcher, with your ice, or I'll be back in an hour. Ensure that we're going back and doing whatever those following through with whatever those tasks are that we are telling our patients. We don't want to break policies and procedures. So we're not, changing policies and procedures. We want to do things that is according to the State Practice Nurses Act, which should also align with our facilities policies and procedures. So, but we do want to keep those promises that we aren't, those things that we're telling our patients that we're going to do. Well, I'll be back with your ice in about 30 minutes. So make sure that we're returning in about those 30 minutes with the ice or whatever. That was just an example. We want to clarify information. We just talked about those techniques about clarifying. That's asking questions in response to the patient's statement, just to be sure that we understand what they are actually saying. We do want to be aware of our body language, you know, make sure that our body language is open, that's receiving. We don't want to have our arms crossed, you know, leaning in, hands on our hips. We want to make sure that we have that nice, erect, opening posture. Negative communication. We just talked about positive. So now we're talking about negative. So a lot of times, because you're looked at as that professional, our clients, our patients will ask us, well, what would you do, nurse? But we don't give advice. Giving advice is actually negative. We want to ensure that the clients have enough information so that they can make an informed decision. But we don't make decisions for them. We don't give false hope and saying, hey, everything is going to be okay. That's considered false reassurances. We want to make sure that they have their questions answered, and it's okay if they want to change their minds. We don't want to give advice. We don't want to be aggressive in our speech and our tone, and we don't want to belittle. Well, you don't know this. We don't want to make statements like that. And then we don't want to make judgment statements either. For example, if a patient is coming in for a particular test, well, you must, I don't know, eat too many apples. That's why you're having to come in for this test. So, and we might not mean anything demeaning by that, but that is considered negative communication. So just stick to the open communication and just sticking to, following the policies and procedures and the guidance that's there is why we're taking care of that client. We don't want to be probing, asking questions that does not have anything to do with the client's care. Asking about, their family members or other things like that. That is considered negative. If it does not have anything to do with their care, we shouldn't be asking about it. So the SBAR, the Situation Background Assessment and Recommendation, this is a format that we use to help us to be able to communicate effectively. Now, we can use SBAR to call a physician, a healthcare provider, to alert them about a situation that's going on with our client. And that situation could be a number of things. Clients had a change in mental status. Client has routinely pain medication, but they're complaining of pain right now. Client has fallen, a number of things. Why are we calling? What is the reason for that call to that healthcare provider? We want to tell them who we are, the patient's name, who we're talking about, and what is going on with the patient. Background, we want to give their code status. We want to give their admitting diagnosis, like when did they actually come in? What is their current status right now? Their level of consciousness, are they alert, they're oriented, times 4, 3, whatever it is. Their current vital signs. We need vital signs. If they're diabetic, we want to go ahead and give, that would be the assessment. We just hold off on that part, but give vital signs, any medications that they have taken, what are their allergies, if they're on IV fluids or not, and then of course their code status. So assessment, for example, if that client has had an altered mental status and we know that they're diabetic, what was that glucose level? If we have one that's current. And what do you think is going on with this client based on your data assessment findings? Altered mental status. This client was alert, talking to us when we went in earlier and served them breakfast. We gave them a bath. They assisted. Now we're going in. They're hard to arouse. They only arousing to vigorous touch. They're not. Initially, we called their name and they responded appropriately. What are our assessment findings? This client initially the client complained of pain on a scale of 0 to 10. They rated it as a 2. 2 hours later, they're rating this pain as a 9. They're grimacing. They have facial grimaces. They're crying. What are those assessment findings? Those are just all examples. So go back to your data collection. That subject and objective information. That's part of your assessment that you're going to report. And then the recommendations, those goals of care, what needs to be done, including the consult. Are there any medications orders? And then also sometimes this client might need to be transferred from facility to facility. Client may be in an assisted living facility. The client may be in a skilled nursing facility, and the client may need to be transferred to the hospital. Within the hospital, does this client need to be transferred from, med-surg to the ICU? So just give as much information as we can to that healthcare provider, because we really are the hands and the feet. We see that we're the eyes of the healthcare provider. Because remember, we're making this phone call. This is a telephone call that we're making. So they need as much information about this client so they can make an informed decision on what orders, what instructions, what are interventions that we will have to implement. So we do use SPAR too for change of shift, that handoff report. We're going home and the next nurse is coming on. This sets a baseline for that next nurse. So when they go in to assess their client, they can compare their assessment findings with our findings and then see whether or not this client has changed, they're the same, they're that worse, or they have improved. So some of the same information, but is our purpose for communicating is a little different. We're changing shift. We're no longer going to be taking care of this client, and we're handing this client's care off to the next person. So conflict resolution, let's go through each of these little bullets here. We accept conflict as a natural part of life. We need to temper our own attitudes and behaviors. We want to be aware of our reactions. Just take a deep breath, because that helps you to think through. Because a lot of times, whatever the conflict initially seems to be, it might not necessarily be that. But if we take a step back and think it through, take the time to critically think, and then it will help us to come to those solutions or the directions toward a solution or resources that are needed. Treat conflict as an opportunity to voice your own opinion and listen to the other side. We're life learners. You just never know what we'll learn by actually taking the time to listen to what the other person has to say. Because sometimes it's just a misunderstanding. It could be they didn't know that visiting hours were a certain time, or they needed to step out of the facility, or that they didn't need, or this patient or their loved one was NPO. They didn't know that they were not supposed to have food. Choose an approach. A win-lose approach will only escalate the intensity of the feelings involved. We want to listen and learn. Conflicts often are based on assumptions and a lack of information. Like the example that I just gave, they might not even know that the patient was not supposed to have anything to eat. Discover what is important. That is what is really the core issue, what is really going on. We want to be respectful of each other. Conflict can be very emotional, but we want to stay away from name calling and blaming and things like that. We want to find that common ground to create the highest common denominator and find a solution for the patient, which is our ultimate goal. We're there to provide that best care we can for our clients. So we want to look at this chart here, chain of command. Under rules of assertiveness, remember, being honest, straight to the point, giving them information that they need to know is always a go-to source. We want to follow the chain of command to resolve concerns. The only time that we would skip the chain of command is if there's an imminent, direct emergency and an imminent need. But otherwise, we follow the chain of command. We have unlicensed personnel, LPN, the staff RNs, the charge nurses, the clinical supervisors, nursing managers. We have the department heads, the DON, and the CNO. If there's something going on with this client or there's an emergent situation, then we might go directly from the licensed practical nurse to the nurse manager or the department head. That's an emergency situation, or we need an immediate resolve or immediate action. So we have non-assertive, passive. We have aggressive and then assertive. Kind of talked about these learning styles already. So aggressive is the opposite of assertive. Assertive is being honest. We're being open. You're straight to the point, but you're not saying the information in a belittling or a derogatory way. Aggressive, yes, you are. You're being threatening. The information might not be factual, may not be honest, and it's said in an aggressive manner. Non-assertive is the person is really not being aggressive and demeaning, but they're not giving the client the correct information, not being honest. They're kind of passing the buck. It's being passive. Okay. And professional healthcare team, there's so many members on the healthcare team, but guess what? That nurse is like that central point. They're going to come to you. The other members of the healthcare team are going to come to you every time. So we do want to maintain professionalism. We want to work together because our common objective is to provide that best care for that client. We want to be safe, practice within our scope, and provide that best care for our clients. And that's what everybody wants to, that's the ultimate goal, to get that client back to the optimal care. They're, hopefully they can, if they've had surgery, hopefully they can get back to pre-surgery where they were up and about and doing for themselves. But we, as the healthcare team, our common objective is providing that best safe care for our client and, deciding, for example, if a client has therapy ordered 5 days a week, but then they have to go out of the facility for a dentist appointment. We want to coordinate, when we're making that dentist appointment, see what time therapy usually sees that client, because more than likely the nurses usually make those appointments in most facilities. And so, when we're calling the dentist, we do want the client to see the dentist. We want the client to get their therapy as well. Try not to make the appointment at the time of that they have therapy. And if you can't get around it, have a conversation with the therapist and say, hey, we understand that therapy is done at this time on this day, but we have tried to get this appointment at a different time. Are you all able to see this client at a different time on that day? Or they may pick up a different day to actually provide that service to that client. So it's all about that effective communication. This just shows all the different people on the healthcare team. Just think about the dietitian. We're needing assistance with a client is needing other food options. Usually healthcare facilities have these standard diets or menus, but if a client has, some food preferences, some dislike or some allergies, we bring that dietitian in to see what other food options are there. If a client they may have something going on with their hands or they can't grip the utensils. What is it that we can use? We bring the therapist in, the therapist and the dietitian, they're working together. Can we use a rounded plate? Can the spoons or forks, can the utensils be built up? But that's a conversation that we will have to have with the other members on the healthcare team. So this client, because we do want the client to still be able to eat and drink. And so if it's using a rounded plate, and they may call that plate something else, but it has like edges on it. So if the client bumps up against it, that they still are able to get the food on that utensil and still able to feed themselves. And it's just a continuity of care. We need to know about continuity of care. It doesn't stop because the client goes from the hospital to the skilled nursing facility, but the client goes from the hospital back to home. We go in to provide that home health care. It's still that continuity of care. And our ultimate goal is ensuring this client receives the best care that they can, that they are safe, and that they get back to that optimal level and as they were, but prior to whatever the situation is that they're in. For example, like I said, surgery. You want them back up and moving and providing self-care. Delivery of nursing care in acute care settings. So total patient care, one, nurse plans and delivers care in the ICU. ICUs is pretty much that nurse does everything for that client. They bathe them, they feed them. If they're getting, fed, by mouth or whatever, it's like that one nurse. Functional nursing, according to the task. Team nursing, assignments according to the capabilities. The RN is the team leader. And then we have primary nursing, that's 24-hour accountability. And then care case management, care coordination within a specified time frame using clinical pathways. Okay. Client-centered, relationship-centered care philosophy, providing care that is respectful of and responsive to the individual client preferences. We want to know what they prefer. What do they know? What's important to them? What are their goals? Individual needs and values, and ensuring that the client values guide all clinical decisions. We want to think about the client care needs, the client care preferences again, and then information so that they can make an informed decision about what their next steps are. What interventions do they want to take part in? Because they have that right to refuse. And we want to support that autonomy. Okay, so the clinical judgment measurement model. Let's look at it. So you have client's needs, you have the client judgment, and then clinical decisions. Okay, we want to recognize those cues. Like, what do those cues mean? We want to analyze it and come up with an hypothesis. What are some solutions? What are those interventions? Then we implement those interventions. We're taking those actions. Then we see, well, hey, is what we did, those interventions that we provided, did it do any good? Is it, we're going to evaluate that. And again, that's that nursing process, an assessment. We're gathering the information, analysis, we're making the connections. What is this information that we've gathered? What does this information mean? Well, let's plan. Let's do something about it. What is it that we're going to come up with? And then let's actually do it, implement, and then let's see if what we did is it going to was the goal met. Okay, developing critical judgment. We want to be um, involved with our clients as much as we can because we want to identify quickly. Is this a difference? This client, is there a change? What is the change? Be specific. The client was alert, aroused to verbal tactile stimuli. Now the patient is unable to be aroused with vigorous tactile stimuli. You know, the client knew their name. They were able to tell us where they are. The client now just mumbles. So quickly identifying if there's something changed with your client. You know, applying those concepts. Well, this is a change. Let me think about it. We need to report this to the healthcare provider. Let's use SBAR. What are those components of the SBAR so that I can communicate everything to this healthcare provider that so they can know what the situation is, so they can come up with some recommendations as what's our next steps. QSIN, the Quality and Safety Education for Nurses initiative, anticipates that collaboration will have a major impact on positive patient outcomes and improved quality care. Okay, so we're collaborating. We want to keep in mind, make sure our communication is open, that we're being positive. We want to make sure that we're providing ethical care, cultural care. We want to coordinate everything, make sure that we're not leaving out of any service, that we're not overlooking or deleting any service that this client is going to actually need. Okay, this is another slide that shows how we're collaborating. Got the nurse and the patient, got the nurses, they're getting together. And then, like, what does this organization provide? What does this skilled nursing facility provide for this patient? And then we have all those that are on the healthcare team. You know, the therapists, they may have occupational, they may have speech. Then we have to collaborate to ensure that all of the services are provided for this client. And a time that we don't want any gaps in care, we don't want any overlaps, any duplications. Okay, so let's look at management and leadership. Management, we're coordinating people, time, supplies to achieve desired outcomes in a defined area of responsibility. We have an appointed management position and a formal line of authority and accountability. And it's transactional. Okay, we can pass this on to the next, but it's transactional. So, leadership, the ability to empower and influence the beliefs, opinions, and behaviors of a person or a group by guiding, motivate others, and inspiring others to reach that common goal. And it's transformational. It's like, you know, it's like that worm changes into a butterfly. You know, it's a whole different process. Now we're considering everyone on the healthcare team. Everybody's working together, even if there seems that there might be some conflict. Those things are being talked about early on. We're being proactive rather than reactive with the leadership. We're being transformational. So let's talk about delegation. Make sure when we're delegating, we want to ensure that we are delegating the correct task to the person. Is it the right circumstances? Is this person unstable or stable? If they're unstable, it is not the right circumstance to delegate a task that they normally would do had that client not being unstable. You know, is this the correct person? Is this person qualified? Are they competent? The right directions and communication. We want to ensure that we're giving the correct instructions, directions, that we're communicating clearly. And then we're communicating, you know, who, what, when, how. All of those components. So there's no gray area or confusion about what needs to be done, when it needs to be done, how it needs to be done, who it needs to be done to. And then even though we delegated, we still as a nurse have to come back and supervise and do the evaluation. So for the 5 rights of delegation, right task, right circumstance, right person, right directions and communication or instructions, the right supervision and evaluation. Did this help? Was the goal met or was it not met? Before you delegate, the client must be assessed. Gotta go in and see. Gotta see what their condition is. Is this client stable or unstable? So a CNA cannot delegate to another CNA. An unlicensed personnel cannot delegate to another unlicensed personnel. So the RN and the LPNs, we can delegate to the CNA and the unlicensed personnel. Delegation cannot be transferred. Well, a task was delegated to person A. Person A and person B gets together and say, hey, well, let's switch tasks. It cannot be transferred. The delegatee can refuse the delegation. And then we need to, as a delegator, to find out why, what is going on. For proper delegation to function, it must be voluntarily accepted. Because remember, they can't refuse. We do want to ask what's going on. Why are you refusing, this task? What is going on? And essentially, the person still has to accept what is being delegated in order to say that proper delegation actually took place. We want to use the nursing process when assigning tasks and delegating. Again, make sure you go back through your classroom recordings. Ensure that you've read your required readings. Make sure that you have your 2 devices, your chargers, and remember the suggestions if you need your exam proctor and or you have accommodations. I will pause now to see if there are any questions or clarification that is needed on any one concept. If you're
I
needing
don't have any questions right now.
Okay. And if anyone is needing, and this is for any of your classes, if you're needing that one-on-one, you have a question about a concept, schedule that time with your instructor. Send them an email and say, hey, send some dates and times. I have a question about this concept. Or it can be an email exchange. So don't not have an understanding of something and wait till after the exam to say, oh, I really didn't understand that concept. Reach out early on and that's why we're here to assist. Take care. Happy learning.